Sarcoidosis and sleep apnea, and we're very excited to have everyone here. My name is Abigail Mangum. I am the project coordinator for Life and Breath. I live in Colorado. Our goals for Life and Breath are to offer the sarcoidosis community effective tools to track their journey, to provide a nurturing environment, and to build awareness within the medical community. So we really focus on patient empowerment and hope. And what you have joined tonight, or you're watching as a recording, is our monthly webinar series. We have not had it not every month this summer, but we try to have it every month during the school year. And we have just patient-focused webinars where we talk about things that affect you as a patient in sarcoidosis. So if you ever have a topic you're really interested in, you can email us at info@lifeandbreath.org, and we will work to get an expert or a speaker to cover that topic. Okay, yes, this is a little bit more about Life and Breath. We have the monthly speaker series. We have patient support with sarcoidosis experts. We do some sponsorships and education for patients. And we have the My Life and Breath Planner, which I'll put the link in the chat. That is a free book that you can request digitally or printed that will help you through your sarcoidosis journey. And we are working on getting it put into an app. All right, so tonight our first speaker is Dr. Raj. Dr. Raj has been with us multiple times before. We're super thankful to have him here. Hello, Dr. Raj.
Hello, I'm like playing with the chat, dude. I love this.
It's
great.
And you're in California, correct?
Yeah, so I mean, you don't even have to read that, everyone. You know, that's me over there. And I'm just super friendly and I love coming here. I love hanging out with Abby, and I'm going to be meeting Josh tonight. So I'm a pulmonary, critical care, internal medicine, and sleep medicine doctor. So it's really cool that even though I just totally love talking about sarcoid 24/7, it's nice to incorporate the sleep in there. And I think that that often goes, under the radar of like, how does having good sleep, easier said than done, help out with just managing your sarcoid in general. So this is great. And needless to say, obstructive sleep apnea, OSA, is such a hot topic right now. Why? I don't know, man. Is it the Zepbound? Is it the Ozempic? Of course, it's such a hot topic.
Yes.
So it's great being here, everyone, and definitely ask as many questions as you want.
Yes, it was funny. So Josh and I were talking, and he was telling me about his journey, which we will get to in a minute. And I was like, okay, we need to get you onto the webinar, and who can I have as a doctor there? And then they were like, oh, Dr. Raj, like that's his specialty is sleep. So we're super thankful to have you here.
Thank
And
you.
as I mentioned, let me share Josh Polito. You've probably seen him before on our social medias and stuff. He does fundraising for Life and Breath through endurance sports, and he has sarcoidosis. And yes, hello, Josh.
Hello, how's it going, everybody? Yeah, I'm Josh. I was diagnosed with sarcoidosis in 2020, and it has been, I will say, a wild ride ever since. Lots of ups, lots of downs, but managing day by day as we all do. And yeah, that's it. Can't wait to talk about all this tonight. Is sleep, as you said, Dr. Raj, is flies under the radar, is super important.
No, it 100% is 100%.
Absolutely.
All right, Josh, I'm super excited to have you here. I'm super excited that you brought this up to our attention, that we get to have this webinar. Let me do a quick read of the disclaimer before we start. This webinar will not give medical advice. No doctor-patient relationship has been established by talking with Dr. Raj or Josh, especially since Josh is not a doctor, during this meeting. Our speakers do not know your medical background and therefore cannot give you any specific medical advice. Speak with your doctor before acting on any of the information you hear this evening. All right, so we wanted to start off. Josh, would you tell us some of your story, your sarcoidosis journey, how you got to sleep apnea, and yes, start from there.
All right. So, yeah, like I said, I was diagnosed with sarcoidosis in 2020. And I had the first few years was very, very difficult. Pulmonary sarcoidosis was the initial diagnosis. And then over time, I had a lot of trouble. My quality of life deteriorated rapidly and sustained that way. I went through a number of doctors, and I ended up at the Cleveland Clinic. And that helped. It's still, I wasn't, my life was not the same. Like one day I could go out running and I'd feel okay. And the next day I'd walk up 3 steps in my house and I'd be out of breath. And some days I couldn't get out of bed. It was awful. So what led me to sleep apnea, or sleep and sleep apnea and all that. So it was just recently that I ended up getting treated for sleep apnea. So 5 years, it was about 5 solid years of continuous weight gain after getting diagnosed with sarcoidosis. And it was unexplained weight gain. I was desperate. I tried every diet. I tried everything. I was running 20, 30, 40 miles a week trying to. I went through, I had a dietitian in Cleveland. I had a dietitian here in my hometown in Rochester, New York. Like I said, I got help from everywhere. And then I didn't think anything about sleep at all that entire time. So let me ask you this, Dr. Raj. So if someone came to you and said, hey, I have unexplained weight gain, would that point you in the direction of getting somebody tested for sleep apnea?
Oh, 1,000,000%. You know what I mean? Let me just say that, being overweight and obese is not a necessary feature of obstructive sleep apnea, because people with OSA, they look like me. They may even look like Abby. I'm going to point her out. Just joking. No, the whole thing is that where is the obstruction with OSA? It's not in the abdomen and belly. You know what I mean? It really is right here around the neck, because Josh, how big is your tongue, your tonsils, your uvula, your soft palate? So I think in the sleep world, pretend I don't even know anything about sarcoid, we as sleep doctors do a pretty horrible job in identifying sleep apnea in certain individuals. Number one, women, because I think we always feel that the questions we ask are you snoring like Jurassic Park Rebirth? Are you kind of like, you know what I mean, having excessive daytime sleepiness? When for women in particular, it could just be a workup for fatigue, and also as we get older, I mean, like my mom, you know what I mean? If I'm only asking those snoring questions, those overweight questions, for people who are older in age, it could be how many trips to the bathroom a night are you having? You know what I mean? So it's definitely going to be, having more targeted questions for different people, because not everyone presents the same way. But if someone says they are gaining weight, they are overweight, they have these issues, don't get me wrong, there is a linear correlation, which is why what is the biggest thing right now is they're targeting weight loss drugs for obstructive sleep apnea. So it is strange that wouldn't open a door, you know what I mean, to kind of get tested for OSA, which is not that hard to begin with.
Right. It's funny you say that about the night bathroom trips, because that was towards the end when I was
Oh,
getting insanely desperate for answers, because I was gaining so much weight that my quality of life, like going to the bathroom, moving around, tying my shoes, like that's how much weight and how inflamed I felt. My inflammation, it was so bad, where I was pretty down about it.
yeah. Josh,
Like it
I'm going to
really,
interrupt you. I want to ask you a question. So
yeah.
timeline wise, and forgive me if you already mentioned this, is that you were already diagnosed with sarcoid, and were you on steroids prior to the OSA diagnosis?
I was on steroids in the beginning, and then so I would say I was probably on steroids for maybe six months. This is years ago. So and then they took me off because they wouldn't. I wasn't giving them the results that they wanted at first.
But your
And
weight gain kept on going up after the steroids were stopped?
oh yeah, I consistently
Really?
gained. I probably gained 80 pounds consistently over the course of the last 5 years, and it
And
was it was
is
pretty.
your mom, dad, siblings, are they type 2 diabetics or anything like that?
No diabetes.
And no history of thyroid dysfunction in the family or anything like that?
No.
Okay.
No. Speaking of thyroid, they checked my pituitary gland. Well, during this whole
I
time,
would.
I've
I
had
would.
so many tests. when they're like unexplained weight gain. I even went to my rheumatologist that I go to get my infusions when I go for those regular checks, and I was like, is the medication causing weight gain? Like what could be happening here? And they're like, we really don't know. I ended up seeing an endocrinologist at the Cleveland Clinic, and I did hundreds of tests. Um, yeah, it was, but I would have frequent wake up in the middle of the night, wake up drenched in sweat, and
Yeah.
then I would have to go to the bathroom multiple times. Like
Yeah.
it was crazy, and it just kind of it gradually happened, and then it got really, really, really bad. Like it progressively got worse quick. Um, and then and I would say this, and it wasn't until I started talking to another dietitian. They're like, this sounds pretty wild. And I'm like, it is. It's pretty bad. And they're like, you should get your insulin resistance tested. And I'm like, okay. So I ended up getting a bunch of tests, and I started falling asleep during the day. Like on my
Yeah.
lunch breaks
Of
at work,
course.
I would fall right asleep
Yeah.
instantly, without warning. And then as soon as my day was done, I was out. It was like getting knocked out. Like I would call it, like as soon as I would sit down on my couch at my house, it was like, I was in a boxing match and I just lost. It was so bad. So I didn't know what to do. And I'm not that type of person. So I ended up there. I saw an ad on something for like a medical device to sleep with. And I'm like, maybe that'll help. I don't know. Maybe I'm not getting good sleep. So I went on my own and got a sleep test. And my primary was like, well, let me see the results when they come back. And I sent the results to my primary doctor, and he was on vacation. I got an automatic message in the my chart that we use to communicate. And he's like, oh, I'm on vacation. I'll get to you. He called me that night on my cell phone. He's like, hey, your sleep results are really bad. You need to get in immediately to see somebody. He's like, I'm actually worried about your heart.
Yeah.
Yeah. And that's kind of how all this went. Um, the rest is history, I guess, after that. But yeah,
Wow.
all these signs I was explaining to my doctor, and you know, so if someone came to you with all of those things, you would say you need to get a sleep test.
Yeah, well, let
Yeah,
me you had so many good little pearls right there. I'm just gonna
yeah,
interrupt for a second. So number one, the night
absolutely.
sweats. I think going in, not everyone, if you're only limited to asking the questions about snoring and waking, you're gonna miss it. And I think anytime you say night sweats, well, people are just stereotyping. Like, are you talking about, some premenopausal woman? Are you talking about someone with tuberculosis? But
Yeah,
no, night sweats could be definitely associated with OSA. Also, everyone listening tonight, I really love what Josh said, which was, you know what? You could sleep a good solid, 7 to 9 hours and still have excessive daytime sleepiness and inappropriate napping during the day. Why? Is because when you talk about getting that good sleep, it's about two Q's: quantity and quality. And that's a key thing that makes me think about OSA, is where, someone's getting enough sleep, but what happens with obstructive apnea is that there's multiple arousals and awakenings throughout the night, things that Josh may not have been noticing. But what's going on is that he's not getting to the two most important stages of sleep, which is deep sleep and REM sleep. Because what happens, he has an apnea and he just keeps on going to a lighter stage, and therefore he's just not refreshed. And the last thing I'll do before I turn it back to Josh is that heart disease. And that's why his doctor, God bless him, from stopping his vacation and calling you. It's like, why are people with obstructive sleep apnea at such a high risk for heart disease? Is because, everyone listening, you tell me, what happens to your heart rate and your blood pressure when you go to bed at night? Does it go up or go down? What do you guys think? And I think everyone's trying to type in really quick, but I'm telling you, Abby knows it, dude. Your heart rate and blood pressure should go down at night, because that's why we sleep, to rest not only our mind, but our body, to give our heart a break. But if you have untreated obstructive sleep apnea with awakenings and arousals, all these stress hormones get released like a cortisol. And you know what, everyone? What happens to your blood pressure and heart rate when you have high cortisol? It goes up. So bottom line point is people with heart disease and hypertension and stuff during the day, they're screwed during the day and they're screwed at night. And they get the double whammy. And that's why it's such a high risk. And Josh hasn't even given me the punchline yet. It was how bad is bad. But he said so many important things, which are summary. Night sweats could be a symptom, poor quality sleep, and it's 100% risk for heart disease when you have untreated OSA. All right, Josh, back to you, man.
Yeah, so I didn't know how bad was, right? So then I had to get in. I had to get in. I went to see a sleep specialist here in Rochester, and so my doctor was like, you need to get checked out. You need to get on something ASAP. Um, so he's like, you're probably gonna have to get a machine. He's like, you probably gonna see a nose throat doctor. So bad was I found out I stopped breathing 128 times an hour. So they said I had 128 episodes an hour. I'm like, there's not even, that's more than minutes there are in an hour. I'm like, what does that mean?
So
I'm
let
like,
me let me put in
yeah.
perspective what it is. So it's called the AHI, the apnea hypopnea index. So that means you add up the number of apneas and hypopneas and you divide it by your total sleep time and you get a number. So everyone, how long is an apnea? Apnea, the word means no flow of air. So Josh is not getting oxygen in or breathing out carbon dioxide. So each apnea Josh is having, by definition, is 10 seconds long. So you can imagine right now during this little webinar, if I just shut up for 10 seconds, I'm not going to do it. It's pretty damn long.
Yeah.
Josh is doing this 128 times per hour. It's like someone putting a pillow over his head and suffocating him. Josh, that is one of the higher numbers I've seen. It's definitely up there, man.
So they also told me that my insulin resistance was the one doctor who saw it. They said that was the highest. I don't remember the number, but they told me they're like your insulin resistance is also. They're like it is super high. It might be one of the highest that they've ever seen, and they're like this is 100% causing your weight gain. So I was put on a CPAP machine, and then they put me on a low dose of Zepbound.
Oh,
Um,
ow, look at you.
yeah,
And let me just say it one more time. I'm loving this conversation.
yeah.
It's that stress hormone, cortisol, everyone. I know I mentioned blood pressure and heart rate, but cortisol increases your blood glucose, your blood sugar. And when your blood sugar is not doing good, man, it damages a lot of things. Josh was essentially a type 2 diabetic. You know what I mean? Not to mention, think about it, Josh, be honest with me. Like when you weren't diagnosed and treated, did you feel like running and going to the gym and having energy, or were you lethargic and lazy during the day? You know what I mean?
So, so I did not feel like doing anything pretty much
Exactly,
ever.
man.
I never wanted to do anything. And then
Yeah.
you throw in sarcoidosis treatments like methotrexate shots and then
Oh, you were
infusions and
taking it
then
as an injection? You get your methotrexate as an
yeah,
injection? Okay.
injection every week. So my weekends are, your weekends you're not working. It's nothing. I could do nothing. And then the side effects from that would last into the next week, and it's just this never ending cycle of what does my life become? Right. And I was trying to run races and go to the gym, and you try and you try to give it best effort, and because you're like I got to lose weight to feel better, and it was bad. It was really bad, and I cannot tell you the relief I had. I remember taking my first Zepbound injection. I was really nervous. I hate needles, and the fact that I have to inject my methotrexate, I never get used to that. And then having to stick another needle in my body and do all this stuff. It was almost a few hours after I felt inflammation relief from that, where I was like, I could just move around. I mean, it might have been the day after, but sitting down, sitting up, moving around, bending over to tie my shoes, even though I gained a lot of weight, it was such relief. And then that was awesome. The first good night of sleep I cried the next morning. I literally had, I tell you, I was so emotional because I felt so much better after getting a full night of sleep. Everybody I talked to, I remember the first time I talked to Abigail after we didn't talk in so long. I told her, I'm like, I tell everybody to sleep. I'm like, if you can get sleep tested, talk to a sleep doctor. I will never shun sleep from anybody or say, no, stay awake. You can just get some sleep. I'm telling you, getting oxygen in your brain and your blood, it's just the best thing you can do for yourself. I feel my life, I might not feel the greatest all the time, but my life is 100% better than it ever was in the last 5 years. And I chalk it all up to sleeping.
I love it.
Yeah.
Let me interrupt and talk to Sandy. Sandy asked a very good question. What is Zep bound? And I think that'll be an
Yeah.
important thing to say.
Right.
So Zep bound is the brand name. The actual generic name is called tisperatide. And this is under a broad category of medications that when I'm talking to dorky medical people, it's called a GLP-1 and GIP agonist. And GLP-1 and GIP are natural hormones in your body whose job is to target the pancreas to secrete insulin and also target the liver to decrease a hormone called glucagon, which actually increases sugars that you don't want in people with diabetes. But Zepbound in particular, who is the brother of another drug called Mounjaro, got FDA approval specifically for obstructive sleep apnea for those who have moderate to severe amount who are overweight or obese. So we'll go more into it, but my question to Josh was, I'm just curious now. Were you given a CPAP, AutoPAP first? How did that go? How did you end up on the Zepbound? What did you fail or continue doing? Or are you doing both right now? You know what I mean?
I'm still doing both right now. So
So
I got a CPAP first.
okay.
And I had it. It was like 2 nights I had it, and then I started Zepbound. It was
Nice.
almost at the same time.
And I would say from my clinical experience, I mean, it definitely was the CPAP that really, I think, was the game changer initially. You know what I mean? Because when you use CPAP, that same night, you are getting the benefits. I know that it's hard to use, and I'm not saying it's the only therapy, but what CPAP does, everyone, it stands for continuous positive airway pressure. So Josh is getting like pressured air blown into him. Josh, were you using a full face or a nasal mask? What were you using?
Full face.
Cool, man. Yeah, you got
Yeah.
to do what you got to do.
Yeah.
Every time the pressure comes in, it opens up the obstruction. In dorky medical talk, it creates a pneumatic splint. Pneumo means air, and splinting the airway open. So I do have patients that feel instantaneously great using it. How long have you been on a Zepbound for now?
Just over 4 months, I think.
4 months?
I think a little over 4 months.
And sorry for being so specific because I'm really into this stuff. Did you start at 2.5 milligrams and you're
Yes.
increasing it every 4 weeks?
So I was on 2.5 and then I stayed on 5 for a period of time. And now
Okay.
I've been on 7.5 continuously.
And is the goal going to be going to 10 to 15, or what does he want to kind of stop at?
So I don't think there's any increase in the near future.
Okay. And that's cool,
Yeah,
man. And
yeah.
it's very important to realize that the studies really show the 10 to 15, but what we know in clinical medicine is what you can tolerate and not get the side effects. And how much weight, and God, I just love talking to you. How much weight have you lost since you initiated the medication?
So between both getting good sleep and the medication, I'm just under 70 pounds down.
In how many months?
It's like 4.5 months. So it's not just that. So there's also a little more to it. I also run. I run like a madman. I am now that I'm getting good sleep. I'm up every day, 3, 4 o'clock in the morning. I am at the gym for 2 hours a day, with running and weight training and all of that good stuff as well.
And I'm glad you said that. And I never want to mislead anyone because if Josh doesn't do those other things, I don't think that it's sustainable, because when you use these medications, you know what I mean? And this is me trying to pretend to be a father to everyone, is that, yeah, you stop the drug, the weight comes back, end of story. And the drug is only going to work as good as you are committed to these other lifestyle modifications. So, hey, let me ask you this, Josh. I'm gonna be a nosy person. So
Yeah.
I love your exercise thing. I'm like admiring you for that. How's your diet? Can you give me some diet tips?
Oh yeah. So well, I I have a pretty I have a pretty basic diet. I could eat chicken and rice every day of my life. Or for every meal. Ask my wife. She gets bored of what I want to eat pretty much daily. Um, but yeah, my diet, I mean, I have, eggs or a protein shake in the morning. I am, I do, I'll be honest, I tend not to eat a lot of vegetables. I do eat fruit. I have vegetables, not regularly, but I have vegetables in my diet. But it's more or less, I have a high protein diet. High protein, and I do eat carbs. I take in more carbs when I'm running longer distances. Um, in a various number of ways. Like I said, I run all the time, so I do slow release, easy digestible carb drinks, stuff like that. Stuff that's easy on the stomach. I will say, and you probably can speak to this, is that I do have a food aversion after taking to specific foods after taking the Zepbound. There are some things where it's like I just don't want to eat it anymore. But I think it proved I think it's weird. It proved beneficial to me. Like I don't have any inclination to eat like packaged food, or like sometimes you'd grab like pretzels or Doritos, like it's quick. I have no desire to eat any of that at all. I always like my go-to is chicken, lean cuts of meat, fish, and if I need carbs, I have sweet potatoes, white rice, and then I'll have apples, or I usually eat like cuties, like the small oranges. That's it. And protein shakes. Protein shakes are a lifesaver for me.
Nice. I mean, I'm looking at you and looking at the chat. I love all these great questions. And I think we should go back to your sarcoid again because people want to hear more about it. But let me just also kind of, yes, if you want to maintain that weight, you know what I mean? Josh will always be the best exerciser and diet person and all those lifestyles. But yeah, I mean, that's the biggest question, everyone. What do we do with the Zepbound now? And of course, you want to be on the lowest dose that's effective. Sometimes you try to wean off the medication. You know what I mean? Everyone's individualized, and the hardest part is that we don't have the data just yet. I mean, I think that there are evidence-based studies to show the benefit in people with OSA who are moderate to severe, who have that elevated BMI, but we don't have any data to say, what do we do 10 years from now with it? And of course, Josh is always going to be looking for side effects and going to have a great relationship with his endocrinologist or prescribing doctor and monitor this. But these are great. So what about your sarcoid? I mean, just in case people want me to comment, what are you on now? And where's your sarcoid besides the lung, or is it only in the lung? And what are you taking currently?
So the medications I'm on is I take a weekly injection of methotrexate every Friday.
And why is
Um,
that? Explain to everyone, because I don't usually give sub Q or IM methotrexate. There's certain times you want to. What was the decision tree to go through the injectable methotrexate?
so that was from the Cleveland Clinic. My doctor out there, he wanted to do the injection because I had such a bad GI response to other medications that he didn't want to use the pills because he said there's no absorbing through the stomach might cause some issues. So he said that you're guaranteed going to get the effects, going to get the benefits from the methotrexate for the sarcoid through injection. And then methotrexate wasn't the cure all. I ended up having to go back to Cleveland too, because I felt like I had the flu all the time, and my eyes would swell up. There was days it was bad. So then they prescribed Remicade. So now I started on Remicade. I probably was on Remicade for 2 3 years, or yeah, probably 2 3 years, every 4 weeks. 2 hour infusions every 4 weeks. And I just recently moved it out to every 6 weeks.
Good for you.
Yeah.
And I love being nosy. That's what I do.
Mhm.
For the methotrexate, what dose are you taking for the injectable? How many milligrams?
I don't know the milligram dosage. I know I take zero point 0.4 milliliters. Um,
And you pull up. Are you
zero
taking
point
the
0.4
auto
mLs.
injecting pen, or are you drawing it up from the
I
syringe?
draw I draw it myself.
You draw it yourself. Gotcha.
Yeah.
So for everyone out there, this is, I'm glad Josh brought this up. So I usually give oral methotrexate. I usually pick my favorite day. You take it once a week. I like calling it methotrexate Monday, so you guys don't forget to take it.
Yeah.
Josh takes folic acid every day, regardless. Even if he takes an injectable, you still take the folic acid. And the drug itself, you want to make sure that it's not irritating your liver. You want to check hepatitis B and hep C. You want to make sure you don't have any kidney failure. You know what I mean? So you always want to make sure you have good kidney function. And I always make sure that my patients get labs every 4 months, a CBC, as well as a complete metabolic panel, looking to see how liver stuff is doing. If my patients can't tolerate it orally, we do it as an injectable. It comes in IM and sub-Q. And you do that so it doesn't go to the liver. It doesn't have to go through the GI tract, so you don't get those GI side effects. And some people just get a lot of GI side effects from it, and especially if he's going on a Zepbound, a GLP-1 type medication, that you can get too much side effects with the nausea, because that's some of the side effects of a Zepbound is nausea, diarrhea, constipation, and all this stuff. So you don't want to confound it. How are your breathing tests, Josh? Is your lung function, did it improve on the Remicade and improve on the methotrexate? Is it stabilized, or you know what I mean?
Yeah, so I still have random flare-ups here and there where I feel, it is it's not often, not as often as it used to be. I feel that my life is significantly better, and it's 100, not 100% what it was before I got sarcoid, but it is close. I mean, I'm like I said, I run Monday through Friday every day that I can, and then I just take it easy on the weekends because the methotrexate side effects, I would say, are hit or miss, where you feel a little groggy, a little down, and you can't really move. Um, but yeah, that's my breathing is, compared to what it was in the beginning, is night and day.
Oh, that's amazing. And
Yeah.
everyone will do maintenance in a different way. So, do you have a sarcoid doctor or a lung doctor close to you? And how often are you checking breathing tests? And how often are you doing any type of imaging like CT scans of the chest?
So I do, specifically, my pulmonary doctor is in Cleveland.
Okay.
Yeah. So I mean, I did not have a good luck in my hometown with doctors in the beginning. Not saying that they did a bad job. It's just I wasn't actually being heard. All the concerns I had. It was a little. It didn't seem like they knew a lot about sarcoid. They're like, well, this is the typical patient, that handles these things. And and after talking to a lot of other people that had sarcoid, they're like, you really got to advocate for yourself. And I went to a lot of other doctors and met a lot of good, they gave me a lot of good advice. And one doctor in particular said, if you were my brother, I would tell you to try to, go to Cleveland, go anywhere else, try to find, somebody who you feel really comfortable with. And that's what I ended up doing.
So is he or she writing the spirometry orders and imaging from
Yes.
Cleveland Clinic, and you get it done in your hometown and send the results over there, is what you're doing?
No, I drive to Cleveland Clinic. I drive to Ohio from New York a couple times a year, and I get a breathing
Oh,
test on there. Yeah,
that's how you do it, man. That's
yeah.
exactly how you do it.
You
Good
can't,
for
you
you.
can't, yeah, you can't put a price tag on your life, right?
No, you cannot. No, you cannot.
Right.
Wow. That's
Yep.
such a great story. Now, what about your endocrinologist? Is he or she in Ohio close to you?
She's also in Cleveland.
Oh,
Yep.
wow. All
Yeah.
right.
Yeah.
You better get some good mileage on your car, you know what I mean?
Yeah. Yeah. Hey, well, sometimes.
Yeah. But we definitely have some good times. So any questions that if you have in particular for me about OSA and the therapies that you're doing now, or if anyone wants to start opening things up, I'm always ready to take it in any direction. But I love Josh's story. It's so great.
Yeah. Yeah. Josh, do you have anything specifically you want to ask? I have
Um,
several questions, so I can.
no, I guess so. My situation, it took with the weight gain and the night sweats. I mean, it took a lot. It took a long time for someone to recommend. I mean, so no one really recommended a sleep test. I ended up doing it on my own. So, I mean, and that can't be the normal with all those symptoms, right? Like it would never take someone X amount of years to recommend, oh, maybe you should get a sleep test, right? Like that's not the normal, right, Dr. Ross?
No, no,
Right.
and you know, and not to mention there are some physical findings. You know, I'm looking at you through a Zoom lens, but for
Right.
everyone right now, neck circumference is one of the giveaways of the higher chance of getting OSA.
Mhm.
For women, it's greater than 16 inches neck circumference. For dudes out there, it's 17 inches. So, I mean, everyone's like feeling their neck circumference right now. But yeah, that's one of the
Where's my
things.
tape measure?
Where is that, dude? But so just I'll ask you another question, Josh. So when you did get the study finally, was it an in-lab sleep study or an at-home sleep study?
It was an at home. It was a little monitor on my finger that synced to an app on my phone. And they just said when you get up in the middle of the night, if you have to go to bed, just bring your phone with you so it doesn't there's no delays or any skips in the sleep test. It was really easy. It was
So
one of the
was it
easiest
was it
things.
called a watch pat by any chance, Josh? Was that what it was called?
I don't know exactly I don't know exactly what it was called, but it was like the little
Yeah,
oxygen
well,
monitor they put on your finger.
and I wanted to tell everyone this, you know what I mean? So in the olden days, and that's how old I am, a sleep study was done traditionally in a sleep center. In like in almost you had to go to a dedicated place that they do these studies. They put all these EEG on your head and all these monitoring. They called it a polysomnography. Poly means many, sonography means measurements. Not to mention they film you while you're sleeping, you know, so you look like Frankenstein, someone's staring at you, it's really creepy. And the ongoing joke was no one sleeps during a sleep study. But now, you know, we have home sleep studies. And when they first came out, you had to wear at least three things. You know what I mean? A pulse ox, you had to put a belt around your waist. And then you had to wear like a nasal cannula. So it would measure different things. But now home sleep studies are so minimally invasive. So what Josh is describing is there are some where you just wear something only over your finger. Some have where you only wear a ring. Some have it where you only wear something over your head, like a sticker patch. There's no excuse, and that's where I'm taking this, is that, you know, the benefits of a home sleep study is that Josh can sleep in his own bed with his own pillow with his favorite teddy bear. Sorry, Josh, you know.
No, it's okay.
And he can sleep when he wants. So if he's a night owl or early riser, there's no excuses that if you suspect OSA that you should get it evaluated. And I'm sorry there was such a delay in Josh's diagnosis. And one
Mhm.
more thing, so if anyone who's taking notes out there, what is the screening to see if you have obstructive sleep apnea? There's a questionnaire called STOP Bang. STOP Bang. It's an acronym. Like the S stands for snoring, you know what I mean? So each thing stands for something. And you get a point for each of the questionnaires that you do. So I hope everyone writes that down. So if you have a high Stop Bang score, yeah, go talk to your healthcare provider and say, I want to get my get a sleep study of some kind, you know?
I just put the link in the chat
Cool.
That's awesome.
for Stop Bang questionnaire.
Yeah, I know you're doing it, Abby. What's your score on the Stop Bang? Are you
Oh,
positive?
I
You
don't
sleep
know. I tell you, my mom, my dad, and several of my siblings have it. So I'm like, oh, great, I need to do this. Okay,
There's
so,
one more thing I'll say too
oh,
after using a CPAP machine. Ever since I started using it, I had a race recently where it was like a 24-hour race that I had a team and we did, and so obviously we would sleep when we weren't running. It was it was the worst sleep I've ever got I've gotten since starting using the CPAP. Right. So it's like I don't know, I don't want to sleep without my machine anymore because I know how great of sleep I actually get with it. And the CPAP machine I has it comes with like an app. It syncs to your phone. You can check your sleep score. It'll tell you if your mask seal is good, all that good stuff. And it's like I look forward every morning to opening it up to seeing that I get a high score and minimal apneas, right? And all those things. I look forward to seeing that every morning because I know my day is going to be good because I had a good night's sleep. So I'll
Yeah.
just say that.
Oh,
I
that's
love Josh, man. I got to tell you that not I see a lot of OSA patients. 40 to 50 million people have OSA in the United States. And, you know, the truth is this, there's going to be someone listening to say, I didn't feel the same way as Josh. Josh is a very unique phenotype of OSA that has the excessive daytime sleepiness. And we know that those individuals are the ones that really, really benefit. People, I mean, that is by hands down where all the data has shown is that it makes you more refreshed, it gives you more energy during the day. And these are the patients who are very motivated to continue using it. Because I do get a lot of patients where they'll get a sleep study because their doctor just feels like ordering a sleep study and they have, they got diagnosed, but they were asymptomatic, and they may not feel the same way as Josh does. So regardless, I think that the take-home message is if you do suspect it in any way, we talked about the atypical ways it could present, just get it evaluated. And, there's not one size fits all for all the therapies. I know we're focusing on OSA, but there are dental devices, which we call mandibular advancement devices. Josh mentioned going to see an ENT doctor, which is an otolaryngologist, where there's different surgical procedures out there. There's positional therapy, don't sleep on your back, and drugs. I mean, it's nut bar. When I first started becoming a sleep doctor, we had 0 meds for OSA. And now, I mean, this Zepbound brand name really just opened up the gates, and there are now newer meds that have nothing to do with weight loss that are in the pipeline for OSA. So it's just really exciting time.
so, Dr. Raj, can you talk specifically about sarcoidosis and sleep apnea? Are they related? What kind of, what are you more likely to get sleep apnea because you have sarcoidosis of the lungs or sarcoidosis anywhere else, or just that kind of data?
Yes. So they're not one equals the other related, but they're strongly associated. You know what I mean?
Okay.
So it's not causality, it's association. You know what I mean? Just because you got sarcoid doesn't mean voila, high risk of OSA. But let me describe this. And you have all the patients listening right now. When you have sarcoid, you're kind of always fatigued. Tell me if I'm wrong. You're not motivated to lose weight and go to the gym. So there's a practical part of it. When you're on sarcoid, how many courses of prednisone has everyone been on? How hard is
Yeah.
it to taper off the prednisone, which is one of the biggest weight gainers in the whole world? How many people watching sarcoid just have the generalized comorbidities of having type 2 diabetes? Because remember, you could have sarcoid and all the other gifts of aging, like heart failure and everything. So there is such a strong association with it. And that's why I don't want to mislead anyone. One does not mean the other, which is why it is very important to control your sarcoid appropriately. Try not to be on prednisone for long periods of time. You know what I mean? Try to be on a regimen that really doesn't make you feel as fatigued, easier said than done, so you can do other things. So I think the take-home message is this, is that whether you have sarcoid or not, the things that Josh said, the things that I said about symptoms of obstructive sleep apnea, get it evaluated regardless. You know what I mean? But,
Mhm.
I think I'm a little different because sarcoid is my passion. I just so happen to do sleep medicine. I'm just a little more attuned to it. Then I'm always looking for that association because sleep studies are so easy to get done nowadays. It's a home sleep study. But it is sad. Josh's story is not unique. It took a long time to get diagnosed with sarcoid, and it took a longer time to get diagnosed with OSA, and some people just don't see the connection.
Hmm. And I know we have several people that are talking about they have asked for sleep studies or gotten sleep studies, and then failed. Their doctors have not given them the diagnosis after that, even though they felt like, the sleep studies. Anyway, talk about how do you get the diagnosis, especially as a sarcoidosis patient, where there is so much difficulty in finding doctors and communicating and being told that you're afraid of being sick, like all of those things. Like how do they go and advocate for themselves to get a sleep study, first of all, and then if they feel like they need a diagnosis, how do they communicate that?
So let's just start off with when we talk about home studies versus an in-lab study. So if you have what we call a high pretest probability, meaning that, hey, I'm talking about Josh again. He has a thick neck circumference. Love you, Josh. You know what I mean? He was overweight. I mean, he had the risk factors. He got a home sleep study appropriately. But let's pretend Josh gets the home sleep study and it comes back normal, because there are memorized cutoffs. If your age apnea hypopnea index is 0 to 5 times, meaning 0 to 5, that's how many times he stops breathing per hour, and it's 5 or less, that's normal. 5 to 15 is mild sleep apnea, 15 to 30 is moderate sleep apnea, anything above 30 is severe. Josh is 100 and, oh my God. So let's say Josh got a normal sleep study and he really suspects it. The gold standard is an in-lab study. So for those out there who got a home sleep study that they swear they have it, then this is where most primary doctors will be like, what else do you want me to do? I got you a sleep study. This is where you have to say, maybe I need an in-lab study, which is the official gold standard.
There you go. Okay. So then let's say they have 5.
Okay.
Or 6. So you're just right there on the
Right.
edge. What can you ask for? Like, what do they do in a mild case? If you
Very
want,
good.
the
So
little things to help.
when do we treat in general? Let's say we're not talking about a specific patient, right? The data is strongest to treat obstructive sleep apnea, regardless of how severe it is, if Josh says the magic words. It's not please, it's excessive daytime sleepiness. Anytime you have excessive daytime sleepiness, that's an indication to treat for safety reasons. Imagine you driving on the freeway, Abby, and that truck driver has untreated OSA, and it's like dozing off, you know what I'm saying? So it's a big safety issue, you know what I mean? But let me just step back and say, it's always important when you have obstructive sleep apnea, not only to treat it, but still get that right amount of sleep. You know what I mean? You could have obstructive sleep apnea treated, but if you're still only sleeping 4 to 5 hours a night, no duh, you're going to be sleepy because you're still sleep deprived, and people need to realize that. But to answer your question, if you have moderate to severe obstructive sleep apnea, you know, those are the ones we're always more aggressive about encouraging therapy. When do we treat the mild amount? It's if you have excessive daytime sleepiness or any other comorbidity, such as heart and lung issues. So for people who have atrial fibrillation, any type of heart disease, any type of lung disease, we will encourage that. So I think that's why it's just really communicating well with your primary doctor. And if they just don't, you know, have the time or take you seriously or just don't know, and it's not wrong for, you know, people not to know, say, hey, I want to see Dr. Raj. No, just joking. I want to see a sleep specialist, you know?
Yeah, I have excessive daytime sleepiness. The magic word. Perfect. Okay, so kind of along with this, you get your CPAP machine, and this patient said they've tried 2 types of CPAP masks and woke up in the middle of the night gasping for air. So they ended up returning them. Have you seen this kind of thing in other patients? And yeah, what can they do if they're struggling with the machine?
These are super easy questions. Number one is that this is not surprising. You know, sleeping with something on your face is pretty freaking hard. You know what I mean? Like, try sleeping with headphones on or something. A lot of us aren't used to doing that. You know what I mean? I think Josh is the gold star patient because he must have been pretty freaking tired because he just loved it. He needed it and it showed. But for people who just don't have those symptoms where the doctor is forcing them to do something, not in a bad way, it's really hard to get adjusted. And that's why, number one, I always recommend trying to get a nasal mask first, which is something that goes in the nose called nasal pillows or a nasal nose mask, because it's not claustrophobic and people will have better response to it. If you're a mouth breather, and in certain cases, you need to go full face, you got to do what you got to do, but start off with a minimally invasive mask. Also, before you start using it, I would spend a couple of days just wearing the mask, watching TV, not connected to the CPAP machine. Just get used to the mask itself. And make sure you have, when you use it for the first time, make sure that your doctor will explain using the humidification device, because you need to use humidified air. There's different bells and whistles where you could ramp up to the high pressure, it doesn't go there right away. There's different things we could do for comfort. And another trick, I'm not going to encourage this, but in some of my patients who have high anxiety levels, I may do a short course of a sleep aid to help them just get that encouragement to sleep with the device on, to say, damn, I can do this. So I'll give a short course of a medication to get them used to it. So, but Josh, does any of this sound, I saw that big smile, dude. Did I hit something good there?
No, it's fun. I put the mask on the first night. It was a little weird for like
Yeah.
10 seconds, and then I don't remember falling asleep.
You're the
It was
best.
instant, and I woke up the next morning, and I was like, I told you I got very emotional because I woke up and I was like, I couldn't believe what I was missing.
That's
It was,
awesome.
yeah, first night, and I've used it ever since.
Yeah. Oh, I wish you were like all my patients. Oh my God.
Josh is an incredible determination.
I'm gonna send his bio to ResMed so he can get paid.
There we go.
Yeah.
There we go.
ResMed.
Okay, so we do have a few questions. I know we're almost out of time. A few questions about Zepbound specifically.
Sure.
Is Zepbound, does that affect inflammation? So would he mentioned specifically inflammation, is Zepbound support in reducing inflammation?
So if Zepbound will pay me to be a speaker, I'll say yes. No, just joking. I mean, let's just be honest. These GLP-1 drugs are a generational drug, right? In my day, everyone wanted to be on a statin, you know what I mean? And before my day, everyone wanted to be on what they call an ACE inhibitor. These are a generational drug. Surprisingly, they've been around for almost 20 years. They were marketed strictly for diabetes initially, and now we're using them for a lot of different things. When you play with your computer, you could Google dementia and GLP-1 agonists. You could actually, they're trying to get FDA approval for osteoarthritis and GLP-1 agonists. People will have what they call metabolic fatty liver disease. They're getting approval for that. So it's just crazy town. You know what I mean? So I would be wrong by saying it does help out in inflammation, but by no means it's not an anti-inflammatory drug, and by no means is this gonna, to Josh, not go on his methotrexate or Remicade, because that's not what it does.
Yeah.
I really think that the hardest part about when Zepbound came out was that everyone's going to think it's a magic bullet for their obstructive sleep apnea, which it's not. And I say that because you have to do the things that Josh said. You have to be strict with your diet, exercise, and all these things. And there is no magic bullet, but that Zepbound, oh my God, who knows? Josh may be on the most minimal amount of CPAP, or maybe not even no CPAP. It's just amazing what the potential is with that medication. And, but yes,
Yeah.
it's not an anti-inflammatory. You're not going to stop your sarcoid meds because of it.
Well, I think that's because he specifically said the day after taking it, he had significantly reduced inflammation. And I believe you connected to that could be because he was sleeping. So I think it's that. Where are we connecting the dots?
So I'll also say this too. If I had to make a choice tomorrow to live without Zepbound or my CPAP machine, I could not live without my CPAP machine. I would choose my CPAP machine over Zepbound every day. And that's just me. I would say that I would rather get sleep and exercise and everything else. That would be me. I couldn't live without sleeping the way that I sleep now ever again. And I wouldn't make that choice. I couldn't give it up.
So what is Zepbound geared toward? How does Zepbound improve sleep apnea?
Well, it all goes down to its sleep apnea, and being overweight and obese is a linear slope going up. The more weight you are, but where is the weight? Once again, it's the weight really centered around the neck and the tongue and all these things. So don't get me wrong. You know what I mean? I think this is an added benefit. And when it got the FDA approval, if your BMI, body mass index, is overweight or obese. And it only got the approval for moderate to severe OSA. So that's what it's
Okay.
targeting. You know, the drug companies pharmaceutical behind Zepbound is trying to convince it targets, muscle mass and excess adipose tissue around, the neck only. Sure, whatever's, you know what I mean? But one-dimensionally, it's really just, hey, lose a little weight. You know what I mean?
Okay.
Yeah.
Okay. That's helpful.
Yep.
So right along with this, if a patient has tried other diet drugs and was not able to tolerate them, is Zepbound similar to other weight loss drugs, or is that a different thing?
Damn, that's a good thing I know my medicine today. So the answer is it's totally different. And, for example, I mean, there are other weight loss drugs that are associated with stimulants and everything like that. And really, it's unique in the sense if someone asked me, what's clinically meaningful weight loss? That studies have shown in general, if you lose 5% of your body mass index, 5% of your total weight, that's clinically meaningful, meaning that, wow, you could have better outcomes in general. The GLP-1 agonists actually proclaim almost 15% average weight loss, which is amazing what that could be. So no other medication besides this category of drug has those proven weight loss in double-blinded, randomized, controlled, placebo-controlled trials. So I don't want to make it seem that this is for everyone. You definitely have to make sure that you're a candidate for it. You definitely have to realize there are people who get the side effects. You got to realize that when you stop it, that, you know what I mean, this weight's going to come back. But these are all great discussion points. You know what I mean?
Mhm.
And I think the take-home message to everyone is that not everyone can tolerate CPAP. Not everyone can be Josh. If it was my job, it would be super easy. And I do feel because OSA, even though we talk about it one-dimensionally, there's more to the nuances of it, and that's why we need to have different weapons out there to attack it in different ways to say, why does someone feel so much better on CPAP and someone doesn't? So there's other things out there to it,
Yeah. Can you expound? I know we're basically out of time. Can you expound on the other options? We've talked about Zepbound. We've talked
Sure.
about CPAP. What other things are there to
Okay, so there's the dental devices. They're called mandibular advancement. You wear something in your mouth. They're usually for mild to moderate obstructive sleep apnea that slowly moves the lower jaw forward, like, in like less than a centimeter. There's positional therapy. Don't lay on your back where your tongue blocks off, your airway. And when you see an otolaryngologist, there are many different things they could do surgically. But the big one out there for everyone is called Inspire. That's the brand name. It's I'm not joking, tongue stimulating device where you implant something in your right chest wall over here, and it has a lead that connects to the hypoglossal nerve. And at nighttime, I'm oversimplifying it, you turn it on, and it actually, every time you breathe, it stimulates the tongue to go forward to block up the obstruction. So I
Wow.
know there's
Yeah,
just a
wow.
lot of things out there, so it's definitely a time to get if you suspect it, this is a time to get diagnosed. It's easily diagnosed, home sleep studies, lots of therapies, and a lot of benefit. I mean, you guys could all be happy and smiling and positive like Josh, you know what I mean? So why wouldn't you want that?
Oh, thank you. And I know we are out of time. If you have a question that you want answered, please, you can email me at info@lifeandbreath.org, and I will connect with either Josh or Dr. Raj and try to get your question answered. Dr. Raj and Josh, thank you so much for coming in. What a fun conversation. So
Absolutely.
educational, so enjoyable. Thank you so much. And thank you everyone else for coming out this evening. We're super, super thankful to have everyone here.
Oh, and one more thing. Hey, I'm on social media. Follow Dr. Raj.
Yes, Dr. Raj is very active on social media. Josh is on social. So Dr. Raj is basically Raj. I'm not going to say your last name right. Dasgupta?
Yeah, Raj the Scoopta. But you know
Scoopta?
what? If you could type in my handle on the chat, you know what I
Yep.
mean?
Yep.
Yeah, come say hello to me on social media. I love it. And we made little videos about obstructive sleep apnea that we posted on social
Cool.
media. So
You
hope you
did.
guys will like that.
And then Josh's handle is Life of Polito. And he posts his fundraisers, his races, and stuff like that. And he does
Nice.
do fundraisers for Life and Breath. And we have more coming. So follow both of them and get great information about all the things. Dr. Raj has a book, he has a podcast. Josh has been on quite a few podcasts. So there's a lot of really cool stuff that they are both doing. Okay, Dr. Raj, let me find your handle.
Oh, I can do it. Watch me. I'm like a pro, dude. It's gonna be at Dr. _ Raj _ And watch this. Boom. Look at me, Abby.
There you
Look at
go.
me.
Excellent. I will share Josh's. Oh, perfect,
Cool.
Dr. Raj. Excellent. Yes. All right, Josh,
All
do you
right.
have a last word?
Yeah, everybody get some sleep.
Yes. Thank you. Thank you, Dr. Raj. You have a last word?
Well, hey, I always love this. I love all my sarcoid patients. And hey, I'm gonna reiterate what Josh says. Sleep is important, sleep is vital. You suspect OSA, use that stop bang questionnaire, get evaluated.
Yes. All right. Thank you both so much. Thank you all. Have a wonderful night. We'll talk.